our conversation now. Dr. Ayodele Odusola is the resident representative for the United Nations Development Programme as we discuss voting in the pandemic and electoral readiness. Also joined by Dr. Aslam from the Progressive Health Forum and Moagisi Sibanda from the Electoral Commission, the General Manager for Civic and Democracy Education, Research and Knowledge Management. Well, of course, Dr. Dasoo, if I may just start with you. For so many people, voting during a pandemic, this is something we've never done before. How difficult is it to ensure that people know they can do this safely?
Good afternoon. I think this is a very important question. No doubt people have a lot of anxiety about this. Ideally, this election should have been held after the country has had a much higher rate of vaccination to avoid transmission. But it is what it is, and I think the IEC, from all, by all reports, has done a sterling job in terms of making sure its venues will be COVID compliant. It's an issue because we could go through all the sorts of hygiene theatre on the day, and in the centres themselves. But the real risk has occurred now in the past couple of weeks, where there have been a lot of gatherings and very poor adherence to COVID protocols. And this is a real issue now. We'll probably only see the consequences of this in a couple of weeks' time. We are no doubt going to see localized outbreaks, at least, if not super spreader events. And this is something we need to keep a very close eye on. As I said, had we postponed these elections to later, say early next year, we would have had a higher degree of the population vaccinated with much less risk of this kind of thing happening. As it is, the fourth wave is on the horizon, and this may well bring it forward.
Moagisi Sibanda, I mean, you try and educate people, civic and democracy education. Has it been harder this time around to make people feel comfortable voting?
Well, it was very important for us, Stephen, to ensure that we inform the public through our communications campaigns as well as our voter education that it will be safe to vote. We are implementing a number of health protocols to ensure that our voting stations minimize any kind of spreading of the virus. And we are encouraging South Africans to also comply with protocols, wear your masks properly, covering your nose, your mouth, so that we complete the safety cycle for everybody who will be coming out to vote.
And did you find, I mean, when you speak to people, I mean, I would imagine there are all sorts of questions about voting during a pandemic. There was a time when we had to really sort of get people to understand how important voting was and how it was done. I think everyone now knows how to vote. But voting during a pandemic is new for all of us.
Absolutely. Stephen, ahead of these elections, we conducted some surveys with our research partner, the Human Sciences Research Council, and we do these surveys before every election to understand voter behavior. And some of the questions this time around included COVID, and of course people were concerned, and we wanted to know what those concerns were. People felt, will it be safe to come out and vote? What kind of protocols will be in place to ensure their safety? And so, for example, we're ensuring that, as you know, we put the indelible ink on the thumbs. It will be done with a cotton bud that will be immediately disposed. So no cotton bud will be used on several people. We are sanitizing surfaces. We are sanitizing the pens. And so it will be safe to vote. People will be sanitized upon entry as well, to ensure that even as they move around the voting station, that they come in fully sanitized and safe to vote on the day.
Dr. Ayodele Odusola, I mean, in a situation like this, innovation is key. I mean, there'll be lessons and there'll be innovations that maybe we can carry forward, but innovations on how to vote safely during a pandemic.
Yeah, thank you very much, Stephen. I think this is something that is very critical because we are doing it for the first time here. COVID-19 is putting the integrity of the election at risk by, one, reducing the intensity of campaigns, decreasing voter turnout, less transparency, and also making elections to be extremely expensive. But I just want to use, this opportunity to congratulate the IEC on several innovative ideas they have already introduced. First, training of electoral workers on COVID protocols to ensure that everybody, voters and the other party officials, follow the protocols. I think that's one thing which is really very important. Two, rotating political parties representation at the polling booth, polling station to avoid overcrowding is another initiative which I think is really novel, because about over 200 political parties are participating in this local election. You can't have more than 5 of them within the polling booth at the same time. I think this is the kind of innovation they are doing. And also the Result Orientation Center, Operations Center, is quite novel and not only compliant with COVID-19, but also a trailblazer when it comes to transparent and electoral reporting infrastructure, which I personally want to commend to all African countries as a good example. But we will continue to work with IEC to promote social media, the use of social media to raise awareness on dangers of electoral misinformation and disinformation, in line with what we did just last year, where we brought 38 electoral bodies in Africa together to think about the role of safeguarding free and fair elections in the digital age. So this is something that I think is really very important. And also building the capacity of domestic observers in all municipalities in the next election, and also to really see how we can promote digital platform for domestic observers is really key, in addition to the civic education that we are currently doing. Now, there are rooms for opportunity for improvement based on the lessons on COVID-19. First, the need to explore alternative in-person voting systems. I know it's really challenging because of infrastructure, but I think South Africa can do it. Second, political parties to use more TV, radio, and social media campaigns as opposed to physical campaigns. Third, the need for us to use digital platforms for reaching out to young people, as was done in Malawi and Nigeria earlier this year. Also, fourth, training of poll workers on COVID protocols to ensure electorate adhere to the COVID protocols in case, as was done in Central African Republic. And finally, we need to deepen online checking of voters register, as was done in Cote d'Ivoire early this year. So there are a number of innovative things that we need to really bring on board, but I just want to let you know the kind of innovative ideas already introduced by IEC is really commendable.
Dr. Dasoo, I mean, elections are not just about election day. We all know this. We've seen large public gatherings during political campaigning. There's been some complaints that more than 2,000 people aren't allowed in a football stadium. But some of the events that we've seen during the elections really would perhaps contravene that. Dr. Dasoo, what's your assessment? Are you worried about a wave of COVID-19 after these elections as a result, not of election day, but of the campaigning?
Yes, certainly. I think we start from the premise that we are still in the grip of the pandemic, even though we have come off the third wave and the level of transmission is low at the moment. But that's exactly the conditions, especially when people are more complacent, for a resurgence. With the election, let me just be clear. I think the IEC has done a sterling job in terms of maintaining a degree of comfort for voters at all of its stations, and that's a huge achievement. I think, though, that politics being what it is, and people going to the hustings, and there's a lot of excitement, and people have been seen in large numbers, not really COVID compliant, and we will see sequelae of that. And one hopes that it's not going to be severe. We always hope for that. But it's not likely that we will not see some kind of even minimal resurgence at this time, given the fact that we are anticipating the advent of the fourth wave at the beginning of December. We might just have to factor in that we may just find that the fourth wave begins a little earlier. And, after all is said and done, the fact of the matter is that a certain proportion of people who get infected will be very ill and some will die. Now that proportion drops the more you are vaccinated. And it was really surprising for us that we couldn't delay these elections even by a few months, until we had gotten a much higher degree of vaccination, because the number of deaths would have been lower. So it's an ethical issue for us. What are the acceptable numbers of deaths in order to maintain the elections at this time? So that's the issue. However, now that we are going ahead, I think the IEC has pulled out all the stops. The stations will be safe. The transportation to the venues, especially in terms of public transport, may be an issue in terms of creating greater opportunity for transmission. But we think that the major risks have already been, experienced right now with the large gatherings, as you pointed out. We hope that it won't be the case, but I can assure you that there is a very keen eye on it, and it's going to be what it is. We are in the grip of a pandemic, and the virus makes the rules, not us.
Moagisi Sibanda, from the IEC, there will be national elections again. You have some time to prepare for them, but there'll be national elections again in 2024. I'm hoping, and I think there will not be a pandemic during that time. But do you think we'll do the elections differently because of what we've learned during this pandemic and voting?
I think overall, Stephen, our behavior as society is going to be very much different going into the future. And certainly, I think if the pandemic is still with us, we may have to behave similarly or even differently and adapt as it does, because it does require us to be nimble and to be proactive and prepare well in advance. I must also say that the pandemic, in terms of voter education, also allowed us to do much more interesting things in terms of rolling out digital voter education, which we did quite well, we believe, this time around. And that's one way in which the pandemic has caused us to change how we do things and change our behavior and our delivery mode for voter education as well.
Moagisi Sibanda, the IEC General Manager for Civic and Democracy Education, Dr. Aslam from the Progressive Health Forum. Thank you very much indeed.